Our dear friends and clients, we would like to discuss a couple of issues regarding the coronavirus situation. A lot of people we talked to during this 1.5 months of our office opening for the emergency services think that when the quarantine for the coronavirus is going to be over, then that things dramatically change and the world becomes safe again, and it will save them from any probability to get infected. The truth is that since the coronavirus 19 exists, it will not disappear nowhere. So even the quarantine going to be over, or even we're still going to use, and we're going to use, of course, those precautions were recommended, like masks, gloves, and 6 feet rule between the people. It's still going to be big probability that we're going to get sick out of that virus. So despite of all those precautions, we have to understand that the only defensive system, the only protection what we have against the virus and bacteria is your own immune system, nothing else. All other things is just precautions, which is there is no guarantees that they're going to help you out or will save you. Some of the people hoping that the world scientists will come with some vaccine which is going to be protecting population against the coronavirus, which is not completely possible because coronavirus, as any other viruses like a flu virus, constantly mutating. So what it means that, let's say there is a type 1 virus, coronavirus 19, and in 2-3 days, on 2-3 hours, or in 2-3 weeks, it's a completely different virus. It's mutated, changed. So it's got different features. So if the vaccine is created for virus type 1, the mutated cannot be treated by that vaccine. So that vaccine will not create an antibody against that particular virus. So it means that there is, from my point of view, as I understand the situation, it is very difficult to get the vaccine which is going to get work on all these types of viruses of coronavirus, the mutated version of it. So we have to be realistic to understand that vaccination is a wonderful thing, but at the same time, it's not effective enough to protect you 100%. The only protection which is real protection of your body is your own immune system, as I said before. And we would like to address a couple of things, how to keep your immune system as healthy as possible and keep that natural barrier as strong as possible in everybody's situation in order to protect yourself from coronaviruses or any viruses or any bacterial infections in your body. As a dentist, we always look at the patient mouth, and there is a different structures of there. And believe it or not, dentistry and dental field and mouth of the patients and the tissues around are number one areas where there is infection located pretty often, and it could be absolutely asymptomatic. So people sometimes get infection for years and years, pretty big infections actually, and have no symptoms, no pain, no discomfort, and they're not really aware of that infection. And any chronic infection or acute infection which is happening in your body, constantly loading your immune system. So your immune system constantly protecting your body from the product of inflammation, product of infection, in order for you, to live. And over the time, when people got this infection, the immune system have certain strength to keep this infection down. But over the time, when the infection is lasting for such a long time, 2-3 months, it doesn't matter, it could be 2, 3, 4, 5, 10 years, 15 years sometimes, it will deplete your immune system. So at the critical times like this areas of pandemic with the coronavirus, it is dramatically important to keep your immune system out of that extra overload with a different chronic or acute inflammation inside of your mouth. So most of the time people do have infection, and it's easy to figure it out if you do have it or not, if you just look at it carefully and just keep it under your attention. It's your gums. It's gums bleeding and a periodontal disease, inflammation underneath of the gums, which doesn't look like a big deal, but it is. It is because it's such a big field of infection inside of your body. If you take a look and just put it on your hand, it can be like whole your hand gonna be all infected. The space, how much the gums taking out of your body. If we take a look at the bone is there is infection in the bone which could really damage and the immune system and be there for a long time without any symptoms. We're talking about any failing root canals. We're talking about cavitation, which is space with the bacteria left after the extractions or traumatic extraction, or leave the infection inside of the bone after the extraction. It could be different materials inside of your mouth, those restorations dentist place. It could be amalgams, mercury filling, and mercury is extreme poisoning, accumulates in your body over the time and dramatically changing the power of your immune system, decreasing it, and cause different inflammation in different parts of the body. It could be crowns with the metal frames, which people could be allergic to. It could be different metals inside of the mouth, like say amalgam and metal frame crowns, or PFM crowns we call them. It could be metal implants restorations, the abutments, and different metal crowns and amalgams on the top of them, where intraoral currency could happen, electrical, which it disrupt the energy circulation inside of your body, can cause dramatic change in the strength of your immune system. So we decided, and during this 1.5 months, our emergency treatment was basically people who got pain, and the service has to be done as soon as possible because it influences the people's life and people's ability to survive. We come out with a certain protocol we follow to find and screen the people, to find that infection, to make sure that nothing is overloading the people's immune system in terms of the dental field, at least. So what we do usually when we can call us and we schedule appointment for you, and that appointment will take us about like 40 minutes. Only one person comes at the time. We're all wearing masks and use all the precautions to make sure that our environment is safe for our patients, and only one patient at the time is coming. And we basically screen all your the bones, the teeth, the sinuses, the TMJ by 3D scan technology. We do the 3D scan. We can basically see all your tissues, all your teeth and jaws in a 3D dimension to look for any site of infection, any failing root canals, or any infections I mentioned before. We can do intraoral exam. We check your gums. We take any soft tissues. We'll take any areas of if you see any infection, we can find that. We use oral cancer screening to make sure you don't have any extra pathological areas inside of your mouth. And we create a treatment plan which is give you the opportunity to see exactly what's going on and get the peace of mind that everything is fine, wonderful, we're happy for you. But if there is a site of infection, you're aware of that, and we can help you out to get rid of that infection, perform the detox procedures, remove that infection out of your body, and to make sure that you will heal nicely. And we use all the technology, all the skills to make sure that your body, your dental health is in perfect condition, in a good condition. And I think it's dramatically important in this time. It is important in general, but now when there is a challenge with the coronavirus and people get infected all over the world. I think that's time for the people, of course, keep the quarantine and keep all the precautions, but you have to be understandable so that those things, it's really not dramatically will protect you personally. It will protect the population and protects the population for rapid spreading of the virus all over the world, all over the city. But in reality, you have to be responsible for your own health, and you're responsible for the condition of your body. You are responsible for the condition of your immune system, and and our task to help you out with that as the dental practitioners who are specializing in detoxification, who are specializing in removing infection safely from your body, who are specializing in a comprehensive dentistry, surgical dentistry, periodontal dentistry, in order to keep you in a best health. I wish you all to be well and safe. Please call us. You can schedule appointment where you get a chance for this screening examination, infection-free screening examination. And as I said, it takes only 40 minutes. It's a safe environment. Please do not ignore your health. Please take care of yourself. Please be responsible for your health, for your natural barrier. Thank you very much for your attention, and have a wonderful day. Thank you.